mental illness knows no bounds. It crosses all age groups, income brackets, and walks of life. A national survey released by Sun Life Financial found that half of Canadians have experienced a mental health issue and that nearly all families are touched in one way or another by mental illness. Dr. Janine Hubbard is the president of the Association of Psychologists of Newfoundland and Labrador, and she joins me live in studio this morning. How are you?
Great. Thanks for having me.
Oh, no problem at all. It's been a little while since we've seen each other, but it's so good to have you back. What are some of the key findings of this survey?
I think a couple of the key findings, and it's important to remember that these are self-report symptoms, so not officially diagnosed conditions, but this is what individuals are saying they've experienced. And about half of the respondents said they had experienced some sort of mental health issue. Just over a third reported depression, about a third reported depression, just over a third reported anxiety, and the remainder reported, a variety of other issues, some much more significant, such as schizophrenia, for example.
No, I said in the introduction, it crosses all age groups,
Yep.
But is there one demographic that seems to be a little more affected than the other?
Well, this was really interesting because they did break it down by age group. And what we found is that millennials were the ones reporting far higher rates. They were actually about 2/3 of them reported that they had experienced mental health symptoms, whereas the baby boomers, it was more closer to 40%. So we're looking and saying, okay, well, are there actually higher rates happening? Or in that population, are they perhaps reacting to some of the destigmatization that's happened, and they're being more open about talking about it?
Yeah, and that's another question, because one of the things in the survey was talking about how it's reported to employers by employees. And is there a tendency now for people to report it to their employer?
Not nearly as much as we would like. They found that about half of respondents were comfortable speaking with their employers about physical health issues, but only about a quarter were comfortable disclosing mental health issues. And ironically, in that millennial population, those numbers were even lower. So that group, even though they're reporting the highest numbers, are disclosing it the least amount. To employers.
So that could speak to the stigma that still exists.
Absolutely. And particularly in that age group, they're new and early entering in on their careers. They may not have the job stability. They may not have, established themselves. So there are real concerns about talking to employers about mental health.
So what should, I guess, both groups do, employees and employers? What should they do to help alleviate some of this?
Both need to be having conversations. I know there is still a stigma and there are concerns about people self-disclosing, but what's really important to remember is because mental health is so much of an invisible illness or disability, that symptoms can often be misconstrued. They can be misunderstood. Someone may think that you're being aloof or irresponsible or, not caring about your work, whereas in fact, if you're somebody with anxiety, it's the exact opposite. But your anxiety is getting in the way and making it look that way. So being able to have a conversation with your boss to explain what's going on is really empowering. The flip side is, I think this is an important message for employers to hear. If half of your employees are saying that at some point in time they're experiencing mental health symptoms, then we need to look at how do we make mentally healthy workplaces and how do we support employees. Looking at beefing up things like employee assistance programs, but also, and some national companies have done a phenomenal job on this in the last couple of years, beefing up the private healthcare insurance. So things like being able to go and see a psychologist.
Is there a fear, do you think, amongst some employers that, they don't want to get too involved or ask too many personal questions, even with the disclosure? Is it easier just to hand an EAP pamphlet to the employee and say, there you go, and then feel like they've got their job done? It should be so much more than that.
Sure. And absolutely it should be. And I think that comes back to, if you look at sort of the age of managers, if we look at that study, that's the group least comfortable discussing mental health issues. So I think we're working on a culture that is becoming more comfortable. And maybe I'm really hoping that people use this study as a launching pad and use it as a starting point to start the conversation.
What can family members do? I know we talk about the workplace, but obviously this is not something that only affects you while you're at work.
No, not at all.
So what can your family do to help support or identify or alleviate?
And sometimes the hardest conversation is to say, hon, I'm really worried about you. I've seen some changes in your behavior lately. Maybe it's worth going and talking to our family doctor about this, or maybe it's worth going and talking to a counselor or a psychologist about this.
Okay, that's just a simple step. But,
yep, but open up the conversation.
Yeah. Dr. Janine Hubbard, thanks so much for this.
Thanks so.
VOCM.